Top 30 Nursing MCQs. Which artery is most commonly affected in an epidural hematoma? Middle meningeal artery, anterior cerebral artery, vertebral artery, posterior communicating artery. The correct answer is option A, middle meningeal artery. In a patient with acute pancreatitis, which assessment finding is most concerning? Elevated serum lipase, abdominal pain radiating to the back, Gray Turner sign, hyperactive bowel sounds. Correct answer is option C, Gray Turner sign. Which type of anemia is associated with gastric bypass surgery? Iron deficiency anemia, hemolytic anemia, aplastic anemia, none of these. Correct answer is option A, iron deficiency anemia. Which position is best for a patient in shock? Semi-Fowler's, supine with legs elevated, high Fowler's, prone. Correct answer is option B, supine with legs elevated. Which cardiac arrhythmia is most commonly associated with hyperthyroidism? Sinus bradycardia, atrial fibrillation, ventricular tachycardia, heart block. Correct answer is option B, atrial fibrillation. Which medication is contraindicated in a patient with increased intracranial pressure? Mannitol, paracetamol, dexamethasone, hypotonic saline. Correct answer is option D, hypotonic saline. Which structure in the eye is responsible for central vision? Retina, optic disc, macula, lens. Correct answer is option C, macula. Which diagnostic test is used to confirm a pulmonary embolism? CT scan with contrast, D-dimer test, chest X-ray, electrocardiogram. Correct answer is option A, CT scan with contrast. Which heart valve is most commonly affected in ineffective endocarditis? Aortic valve, mitral valve, pulmonary valve, tricuspid valve. Correct answer is option D, tricuspid valve. What is a classic sign of Addison's disease? Weight gain, hyperpigmentation of the skin, hypertension, increased appetite. Correct answer is option B, hyperpigmentation of the skin. Which complication is associated with total parenteral nutrition? Hyperkalemia, hyperglycemia, dehydration, thrombocytopenia. Correct answer is option B, hyperglycemia. Amniocentesis is performed to detect pregnancy complications, ovarian cancer, fetal abnormalities, uterine fibroids. Correct answer is option C, fetal abnormalities. Which ECG change is most concerning in a patient with hyperkalemia? Peak T waves, prolonged PR interval, ST segment depression, sinus bradycardia. Correct answer is option A, peak T waves. What is a hallmark sign of myasthenia gravis? Muscle rigidity, progressive muscle weakness, loss of deep tendon reflexes, tingling and extremities. Correct answer is option B, progressive muscle weakness. Which diet is most appropriate for a patient with liver failure? High protein, low carbohydrate, high fat, low sodium. Correct answer is option D, low sodium. Which medication is used to treat bradycardia? Epinephrine, lidocaine, atropine, dexamethasone. Correct answer is option C, atropine. Which test is used for diagnosing chronic obstructive pulmonary disease? Spirometry, MRI, chest X-ray, pulmonary angiography. Correct answer is option A, spirometry. What is the primary goal of care for a patient with sepsis? Prevent fluid overload, maintain tissue perfusion, reduce pain, promote sleep. Correct answer is option B, maintain tissue perfusion. Which of the following is an adverse effect of ACE inhibitors? Hypokalemia, bradycardia, hyperglycemia, dry cough. Correct answer is option D, dry cough. Which dietary choice is most appropriate for a patient with celiac disease? Whole wheat bread, rice, barley, none of these. Correct answer is option B, rice. Which route is used for administering epinephrine in anaphylaxis? Subcutaneous, intradermal, intramuscular, oral. Correct answer is option C, intramuscular. Which diagnostic test is used to detect kidney function? Creatinine test, spirometry, ECG, lipid profile. Correct answer is option A, creatinine test. Which of the following is a primary characteristic of Cushing syndrome? Hypoglycemia, weight loss, hyperkalemia, hypertension. Correct answer is option D, hypertension. Which acid-base imbalance is commonly seen in a patient with prolonged vomiting? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Correct answer is option B, metabolic alkalosis. Which intervention is most important for a patient with acute kidney injury? Restrict dietary protein, monitor for signs of hypokalemia, administer loop diuretics regularly, encourage oral fluid intake. Correct answer is option A, restrict dietary protein. What is the most common cause of hospital-acquired infections? Poor hand hygiene, inadequate ventilation, contaminated food, insufficient antibiotic therapy. Correct answer is option A, poor hand hygiene. Which electrolyte imbalance is commonly seen in tumor lysis syndrome? Hypokalemia, hypercalcemia, hypophosphatemia, hyperkalemia. Correct answer is option D, hyperkalemia. Which sign is most indicative of fluid overload? Dry mucous membranes, edema, tachycardia, decreased urine output. Correct answer is option B, edema. What is the purpose of a nasogastric tube in bowel obstruction? Administer medications, measure gastric pH, provide nutrition, remove gastric contents. Correct answer is option D, remove gastric contents. What is the antidote for warfarin overdose? Protamine sulfate, vitamin K, atropine, sodium bicarbonate. Correct answer is option B, vitamin K. Thanks for watching. Subscribe to the channel for the latest informative MCQs.